This news left a very sour taste in my mouth. A government-commissioned review of the nation's eating habits has recommended the introduction of the world's first tax on sugar and salt. England's National Food Strategy said the health consequences of our malfunctioning appetites, thanks for that, result in 64,000 deaths and a £74 billion cost to the economy each year. The report also suggested prescribing fruit and veg and cooking lessons on the NHS to families who are about to have billions of pounds added to their shopping bills. The Prime Minister has his reservations.
I think there are some good ideas in it. As I said earlier on, we believe in tackling obesity, trying to help people to lose weight with promoting exercise and tackling junk food advertising and so on. I'm not, I must say, attracted to the idea of extra taxes on hardworking people. Let me just signal that.
For now. But the controversial proposal does have its defenders. Dietitian Ro Huntress says the tax could help raise awareness of excess sugar consumption and influence behaviours for the better. However, Daniel Pryor of the Adam Smith Institute argues the tax will hit the poorest people the hardest and could kill off some of our best loved brands. They both join me now. Ro, look, I've struggled with my weight my entire life. I've been a lot heavier than I am now. I've also been a hell of a lot lighter than I am now. And I can tell you what, my decisions over what I eat have absolutely nothing to do how much the food costs. And I actually think that applies to virtually everyone who battles with their weight. The issues are complicated, they're emotional, and I just don't think a tax will actually solve the issue. Why do you?
I think you're completely right in that this issue it's so multifaceted, and the proposal that's being put forward is just one small part of basically a very big puzzle. But you know, I worked as an NHS dietitian for several years, specialising predominantly in diabetes and weight management. And when we had certain groups with these patients, we asked them, you know, what do you think are the reasons behind your weight having increased and the levels of obesity as they are? So many reasons came up, but one of them was the foods that are around us, the accessibility to those foods, the formulations of those foods, the marketing that surrounds those foods, and even the way that supermarkets are set up. So, you know, I have my views in terms of, if we were able to, say, reformulate food products, then that can have an impact on, you know, sugar and salt levels in foods and therefore consumptions. But I'm also hearing it from the patients that I've worked with to say we would actually favour some support from, you know, policy and practice. So I hear this from my patients too.
But Daniel Pryor, isn't the issue that those businesses should be able to sell whatever food they want? We're a capitalist society. And why should someone who's very thin and doesn't have any problem with their diet or their malfunctioning appetite, as this report says, be stopped from buying Haagen-Dazs ice cream or a Domino's pizza if they can control themselves?
Yeah, as someone with high metabolism, I count myself amongst that very lucky group there. Look, Henry Dimbleby, the guy that... so does my girlfriend. Henry Dimbleby, the guy that wrote this report, would like you and I to pay an extra 57p for a jar of strawberry jam. That might not seem like much to some people, but for those of us who struggle, it will hit their wallets very hard. And as with most sin taxes, as was mentioned in the intro, it'll hit poor people the hardest. I mean, I'm lucky now, but back in my student days, living out of home, I was on a tight budget. Me and my flatmates probably spent hours in supermarkets across the whole time comparing own brand cereals to branded cornflakes just to save a few quid. Yeah, and we're just trying to recover from the deepest recession in 300 years and a pandemic. People have lower incomes. They're struggling to get jobs. And these new taxes are just going to push up the price of everyday food and drink. We estimate an extra £172 per year for every household.
And that's the issue, isn't it, Ro? It's going to hit the poor people in society, the people who really struggle to buy food as it is. Whereas someone like Boris Johnson, who's trying to lose weight at the moment because of his near-death experience, the cost of something actually has nothing to do with the reason why he's trying to lose weight.
Yeah, so I think, well, going back to the point about the jam, for example. So most people think, oh, raspberry jam, strawberry jam, the main ingredient in it must be raspberries or strawberries. If you go and pick up a jar of strawberry jam, the first ingredient on it will be sugar. So it's actually got more sugar than it has strawberries or raspberries. So that highlights an issue in terms of these products. And it's the same in, with regards to certain cereals as well that have been mentioned. The formulations could really do with being revamped. And that's one of the suggestions as well.
So you're saying you want the companies behind these products to be forced to take a lot of sugar out of them, and they might do that if they were going to cost a lot more money given this potential tax?
So I think in terms of the tax, my preference, because the main issue here is everybody's kind of worried about those that will be the hardest hit and those that are more disadvantaged, and we all agree with that. So if the manufacturer is able to take that responsibility, then that will kind of be the best option. And we did see that with the soft drinks sugar levy, manufacturers did make big changes, and we saw a significant reduction in the sugar levels in drinks. So,
yeah, but you know what that has resulted in, Ro? And as a dietitian, I'd be quite surprised if you actually endorse this. All it's resulted in is people drink Diet Coke instead of Coke, or Pepsi Max instead of full-fat Pepsi. And as a dietitian, you'd probably concede there are just as many questions around all of the artificial sweeteners in those diet products.
Well, every artificial sweetener or every sweetener has what's called an ADI, so an acceptable daily intake. And for anybody to be even close to being at risk of any adverse health implication from consuming sweeteners, if you compare it to, say, like cola, for example, you'd have to consume 15 cans of Diet Coke a day, every day, to even be at risk. So actually, you're going to have a small, a low to moderate inclusion of sweeteners in your diet. That is not, it's not thought to have an implication.
Okay, this is great news. This is great news, because any dietitian I've consulted has always said to me, Dan, you've got to stop your Pepsi Max addiction. So this is great. I can have 15 cans a day. Thank you for that, Ro. Very happy about that.
15 cans a day. Yeah, come on. We want to be moderate in our approach. That's kind of like nobody's going to obviously be consuming at those quantities.
Okay, I mean, look, Daniel, the broader issue here is that this government was meant to be led by a libertarian prime minister, and it seems like he wants to be involved these days in every aspect of my life. What I wear, whether I cover my face, what food I eat, whether I eat meat, and fundamentally, I just don't actually believe it's any of the government's business what I put in my mouth, what I consume, and whether my appetite is malfunctioning or not. Can't they just butt out?
Yeah, the clip that you showed at the intro to this debate actually shocked me. I'm sad that I was shocked by seeing Boris Johnson talk about not wanting to put up taxes on ordinary people. But coming to this kind of reformulation side that we were talking about, for many fans of the original recipe Iron Brew and Lucozade, I'm sure the consequences of that are depressingly familiar. It ends up ruining the taste of some of our favourite foods. And this fact that reformulation can result in worse tasting food, it's often dismissed as unimportant. A while back, someone from Action on Salt, the public health group, argued that cutting salt content is easy because all it does is add flavour, as though that's just not an important thing at all. I think that enjoying food is not something that should be kind of rubbished. It shouldn't be a kind of simple pleasure that you look down upon.
Why should you be punished with your very sensible appetite because of someone like me with my malfunctioning appetite? I've got to sort it out myself. And actually, I think the fundamental thing is to lose weight, and I've learnt this the hard way, it is a personal decision. You've got to make the decision, then you have to stick to it. And no matter the cost of food or what the government tells you to eat, it's not going to make a difference. But a fascinating debate there. That was the dietitian Ro Huntress and Daniel Pryor from the Adam Smith Institute. Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.